According to the St. Lucia Annual HIV/AIDS Surveillance Report of 2012, since the first diagnosed case of HIV infection in 1985, the annual number of reported cases has followed a steadily increasing trend of peaks and troughs.
We've had 0% mother-to-child transmission over the last 5 years, so there are less children being introduced into the pediatric program. And as well, we've had success in terms of increasing access to services for persons living with HIV. And we also have support groups that help persons living with HIV to sort of take care of each other. And there are other things on stream that we'd like, such as perhaps voluntary male circumcision to reduce the risk of transmission of HIV, which studies have shown has had a great impact in Africa.
Tender Loving Care, or TLC, is a support group for persons living with or affected by HIV.
Though I can say that we've come a long way, it is still pretty much real. This is why we've not gotten anyone to come out publicly to speak, because, of the stigma and discrimination, they actually face with. Whether it's on mere speculation that a person might be positive, but it affects them directly, and it's very, very much real.
Patients do not want to be stigmatized by anybody, even their family members. That's why they don't even tell their own family members that they have the disease. Because a lot of times they might not trust that person might speak to other people, and then that level of discrimination can disseminate, be pervasive in the home and in the community.
The Caribbean HIV/AIDS Alliance is a core support organization for people living with HIV. The aim of the organization is to reduce HIV transmission among key populations by working with persons who are positive to improve their quality of life and prevent reinfection.
The Caribbean HIV/AIDS Alliance does not operate on its own. We do not have parallel programs, HIV programs. We exist to support the National AIDS programs in the 7 countries where we operate. What we found with key populations or with most at-risk populations, even if the structures are there, the services are there, they do not go because they feel that when they go, they've been stigmatized and discriminated.
Stigma and discrimination does play a role, especially with patients who are admitted into hospital. When you're given the diagnosis, it's very hard for them, and it takes them a while before they actually accept that. Some people don't accept it, and they give up. They give up and they die, and that's what kills them. It's not the disease itself, but just the stigma, just the feeling of you having HIV. That's what actually kills a lot of people.
There was a situation reported to us where preschool, a little child toddler was kept in a corner because the parents were thought to be HIV positive. They refused to allow the other children to play with her or for her to participate in activities at that preschool. When we hear of these stories, we realize, the depth of work that still has to be done.
Let's not look down on anyone, because HIV will not respect anyone. If you put yourself in a position, in a position to contract the virus, or sometimes, even sometimes, you might just be a husband or wife who feel that your wife or your partner is so faithful to you, or you're so faithful to them, and they might just go out there, and it might just be a one-time thing. It might just be one time you have a sexual intercourse or some sexual contact, and you get the virus.
So we're moving in the right direction, and it's a question of having people to come forward to get tested for HIV and making them aware that HIV is now a chronic disease and that they can live a long life just like anybody else with HIV.
You can't tell by simply looking whether a person is HIV positive, but you can destroy someone's life through stigma and discrimination. Today, HIV is viewed like any other chronic disease like diabetes or hypertension. The hope of achieving an AIDS-free generation is to learn to love, protect, and have respect for one another. From the Media and Communications Unit of the Ministry of Health, I am Glenn Simon reporting for Live Up the Show.